So, welcome to Spectrum Healthcare's Right Time Tuesday. We are going to be joined here in just a moment with one of our educators so that we can go over what the Right Time program is and how it can benefit you and how you connect with us to get all that coordinated. Throughout the live stream, please submit your questions and we will answer those as they come in. So let's bring in Allie. Let's see. Allie, and we need to unmute you.
There we go.
There we go. Oh, wait. There we go. Perfect. So welcome, Allie.
Hi, it's nice to be on here. It was weird to hear the countdown at first. It was really prepping me for this.
Looks like we're having some trouble.
Can you hear me?
Getting Allie so we can hear her. Let's see. Give us just a minute as we're trying to figure out how to. No. All right. Well, Allie?
Can you hear me?
Nope. Oh, gosh. So everybody can hear me, but we can't hear Allie. Huh. So, well, gosh, we will have to figure that out.
Can you hear me now?
Nope. Yeah, I should be able to hear her, but looks like we're still trying to figure that out. Is your laptop connected to your AirPods? Is that what you're trying to connect to?
Yes.
You may have to disconnect that and just use the mic on the laptop.
Okay, let's try that. It even... Can you hear me now?
Nope.
Can you hear me now? Yes or no?
No. Well, it doesn't look like we are going to be able to connect with Allie. We've got some sound issues there. Interesting indeed. Okay, so I'm going to go ahead and take Allie out, and we'll get back with her another time. Bye, Allie. Gotta love technology. So I will go over briefly what the Right Time program is for everybody and how you can connect with us. So the Right Time program is about being able to connect with a provider to choose the best contraception method for you. And what's really cool about this program is that you are able to meet with an educator that educator is able to help answer questions, provide you with good medically accurate information so that you can choose what is best for you. And that's done through just presenting you with all of the options. And there are tons of options out there. One of the things that's really great about this program is that we can connect you with that at low or no cost, whatever your chosen method is. So if you choose insertion of an IUD or the Nexplanon or NuvaRing or birth control pills, really, we're looking at what's best suited for you, what is going to be the easiest and most sustainable for you, and connecting you with those resources. And so the process is fairly simple. You're going to call and set up an appointment, and you can see right there on the screen is our phone number to set up an appointment. And you'll meet with an educator first and go through all of those options. And this information is presented in a judgment-free way. We don't have any particular feelings one way or another about what you choose. We're trying to educate you so you can make the best choice for you. You'll do that education, and then you'll meet with our provider. And during that interaction with the provider, you're going to be able to say, this is what I know is going to be best for me. There might be a physical exam to make sure that everything is in good shape for an IUD placement. We'll go over risk factors once again for all of that with your provider, and then you'll receive that during your visit. So really, we're trying to get you connected in the least number of visits possible so that you can obtain birth control for you that you are comfortable with, that you're going to stick with, that's going to best meet your lifestyle and your health conditions. This program is provided through a grant through Missouri Foundation for Health, and it is administered by the Missouri Family Planning Council, and we are one of the contracted agencies in Missouri. And so there are other locations, and you can visit therighttime.org to find a location nearest you. So there are places all over the state where you can connect with these services. It doesn't have to be just here in Columbia. We are the provider, one of the providers here in Columbia where you can get this resource. Let's see. So they will also be doing, so Allie's feeding me some information along the way since we couldn't get her audio working right. So they also do family planning consultations to ensure whatever method you choose matches your family planning goals. So obviously, if you're wanting to start a family in the next 6 months, maybe having a Nexplanon insertion isn't the best way to go. So they're going to be able to ask and have all those questions answered for you. So when you get to that point that you want to choose, you're fully armed with the best information possible. And I think that's really kind of the root of a lot of this is, yes, we want to connect people with their contraception method of choice, but we want them to be educated about all of the options that they have. So they really are making the best choice possible. With that said, I'm going to try and add Allie back in really quick just to see if we have resolved anything. Let's see.
Can you hear me?
Nope, still. So Allie is just the face at the moment, and we will work out our technical issues because we're going to continue doing these Right Time Tuesday events. We're going to talk about specific birth control methods that are available and talk about how they function, the science behind them, who they're really best for. But we also wanted to have an opportunity for you to put a face with the people that you're going to meet. And Allie is one of those people. We're just not able to provide a voice to Allie today. So yeah, that's really kind of it in a nutshell. We aren't going to stay on here long today and drag this out. Oh, Chelsea can hear Allie. I just can't hear Allie. Interesting. Why am I not able to hear her?
Thanks, Chelsea, for chiming in. Because everything on my end looks like it is A-okay. Says I'm in the show. Everyone can see and hear me.
So yeah, Allie, and we're getting feedback that people can actually hear Allie, so that's good. She just put into chat that they're trying to aim to give 3 months to a year's worth of whatever the method that you choose. So if you're choosing the birth control pill, we're going to try and give you that, ideally a year at a time, so that you don't have to come back and visit with us. We're really trying to connect as many people as we can with our methods.
And the idea behind...
Yeah, we're getting other. So Allie, I'm just going to let you go ahead and talk about the program since other people can hear you. I can't, so you just have to wave at me or put in the chat when you're done. But if you want to go ahead and introduce yourself and talk about the program, I'll just kind of hand it over to you for a little bit.
Okay, sounds good. Hi, I'm Allie. I'm a community health worker here at Spectrum Healthcare, and now with the Right Time Grant, I am helping out, and I'm one of the outreach and education coordinators. So that role will help this whole initiative by providing the client or patient-centered information and education. So I'm going to give them all of their options. And some of the fun handouts and a lot of the information we're going to give is super user-friendly. It's really a great way to help you learn about all of your options, as well as you making the decision with all of the information given to you. So we make sure to ask you all of the questions that you wouldn't even think to ask to make sure we get the right method that is for you. And one of the pieces is it is free or low cost, depending on the option you choose, regardless of your insurance status. So that's one thing that Missouri Family Health Council and MFH is their mission. They want to make sure that financial barriers are not there. And then kind of piggybacking off of what Kale was saying about the 3 months to a year's long worth of medication, we want to give you all of everything you can have without having to have more barriers in place. So if going to the pharmacy every single month to get your prescription is a barrier, we want to eliminate that and give you as many of the refills we can give you. That way you have it ready in your bathroom cabinet or sink if it's the pills or the NuvaRing. And so that is something that we want to make sure we give to you. So we aim to have as little appointments as possible, make it quick and easy for everyone. And there is an option for everyone. So it's worth exploring and having an appointment to at least have the consultation piece. So if you decide it's not for you right now, then you've learned that it's not for you and you know when to next use this service if you need it. So we're hoping to get this rolled out pretty soon.
So Allie, I can actually hear you now, and I'm not going to confess to why I couldn't hear you because it was me and really a stupid thing I did. So, so when a person meets with you, and we have another staff member who provides the services. So if somebody calls and schedules with you and or Christy, how long do you think that appointment is going to be?
The consultation piece itself will probably be at least 30 minutes to an hour. Okay. And that is just because we want to give everyone their options. But certainly if someone has come in and have done their research and they know it's between 1 or 2, they just want to get a little bit more verification, then those appointments will probably be more like 15 to maybe 30 minutes. But I think for someone coming in with no education or on this topic or has no idea what to do, it could take at least 30 minutes to an hour.
Yeah. Are there methods that the program doesn't cover?
As far as I know, no. We cover at least one type of every method, whether That's the pills, the NuvaRing, the Nexplanon. We even, some of the other ones we would cover would be the shot and the implant, so ones you can't really see. But yeah.
Okay. As an agency, we always have barrier methods that are available, condoms, dental dams, things like that. And we encourage people to incorporate those, into their mix. So one of the questions that we got, Allie, is how long after the initial consultation would it be before you're connected with your birth control?
Ideally, it would be same day. Now, if you have one of the LARCs, the longer acting contraceptive methods like an IUD or maybe even an implant, and there's a scheduling issue, we're going to try to get you in as soon as possible. But we want to make sure that you have seen the provider, and we can make sure that that gets done safely and timely. But those are the two issues that we might have if it's not same day. But
yeah.
I think we've talked about making sure that it's same week, at least. So,
we are looking at a short turnaround between your consultation time and the time you actually get that.
There definitely could be times where there could be an open appointment slot now that we have two providers. So,
yeah. And both of our providers, both Dustin and Lola, are fully trained to provide these services. So that gives us a little bit more flexibility in getting people connected quickly to an appointment.
And also, when you talked about all prevention or barrier methods, and Melissa, our nurse, also says this: come every day and we'll give you condoms. So we have condoms, we have the non-latex kind, we have dental dams, we have lube, we have all of that in our prevention packs with our STD testing at Spectrum too. So that's something that we can make sure to give, as well as the family planning side.
And so what about aftercare? Do we provide that? Is that something that we would connect people with? So after they have insertion, or what, do they come back to us if they have concerns?
Yes. So we would kind of be their point of service for that specific healthcare service that they have. Lola is also a family, a nurse practitioner, a family, what is the word I'm looking for? Family practice. So she can be your point of service for that, and we should be. So, and that's something also to talk to the provider about. If you do have any issues about certain methods, especially with the IUD, or if you have the depot shot, if you might be not a good candidate, that's something to talk to the provider about. But
yeah, and those are some things that obviously aren't going to get covered in that consultation, is the deep dive into your personal medical history. Obviously, our educators are going to be able to tell you who is maybe at risk for different things given risk factors, but you have an opportunity to talk through a lot of that with the primary care physician or nurse practitioner that you're going to see for the services to, if you have a history that puts you at greater risk for failure with an IUD or the depot shot or things like that, you'll be able to talk to that provider about those specific things.
Yeah, and that is the only thing, whether that would prevent you from not getting the exact option that you want. We want to be able to offer you any single option you want, and we will. We just need to make sure that it's medically safe, and that's mainly concerning the IUD. And possibly the Nexplanon, but mainly the IUD and the sizing. That's kind of if it doesn't work. So that would require a physical exam.
Yeah, because if you are selecting like a diaphragm or something like that, then there are limitations around that and sizing issues, and so. But all of that will be covered with the primary care physician.
Mm-hmm. And that's usually pretty rare. I remember Kristen from Missouri Foundation for Health, she was saying, or Missouri Family Health Council, she was saying how it's usually if someone wants an IUD and they know that there's no really indications that they couldn't, then more than likely they're A-okay to get it. It's just that small subset that wouldn't be a good candidate for that.
Good deal. So are there, when you talked about low cost, who are people who might fall into that low cost category?
That would be people with insurance who would help cover that cost. So if you have no insurance, it's not going to be anything out of your own pocket. It's just if it was with insurance, we would work and figure out the copay situation if there was one, which most insurers probably, they cover most preventative contraceptive options, but we would help work with you if there was a copay to get that at the pharmacy.
Okay. What about men?
Men are definitely able to help and get that family counseling, that family planning counseling piece. And we encourage it. Now, they can come and get condoms every day too, but they wouldn't be someone who would get an IUD. So,
right.
But we do have services for them. And we definitely encourage men to talk about family planning just as much as women. So that's something that we're hoping to see more men come into our clinic for that reason.
Excellent. Now, in addition to, selecting your appropriate contraception method, we also provide STI testing services. So we test for chlamydia, gonorrhea, syphilis, HIV as part of our STI clinic. And Allie works with our interns to cover that portion of it. And we would encourage people, if they are sexually active and are thinking about, this family planning aspect and contraception, that they also consider getting tested, and especially if they have multiple partners, that testing be routine for them. And you can call that same number at the bottom of the screen to schedule a testing time. And that may actually be a good entry point into care with us, is to get that routine testing done. And then you can mention while you're in for testing that you want to talk about contraception, and we can get you the ball rolling and get all of those things covered. So we really are trying to focus on the entirety of your health and cover all the bases to make sure that we aren't missing anything in that process.
Yeah. And with those, we really stress prevention on all aspects. So hopefully getting you in on the prevention side will be kind of your point of entry too. So that is what we're looking for.
Yeah, because those contraception methods, while they are great at preventing, unintended pregnancy, a lot of them don't do anything to prevent STI transmission. So we really encourage people to adopt that harm reduction model and, see how we can reduce risk all the way around.
Yeah. And then this way with the Right Time Initiative also gives women the power to make their own choice at whatever time frame or anything that they want. So it's kind of nice that we're able to offer that for those people out there.
Now, would you, if there was a couple who was interested in family planning, would you work with the couple?
Yes. Yep.
So they could both come in and you could talk through that process. And find
Absolutely.
out what
that's encouraged.
Excellent. Well, as we move through this process and start, so next month in January, we will be focused on introducing the methods. And our educators have gone through extensive training to be able to talk specifically about each individual method and have lots of resources to give you to walk away with. But we would like to, encourage people to reach out to us in the meantime if they have questions, and we will be able to get back with them and ask those specific questions. So before we wrap it up here, Allie, is there anything else you want to add about the program or any highlights that make this, a different way to access care?
It's an easier way to access care, I think, and it is in an environment that is very patient-centered, non-judgmental, The atmosphere just, it doesn't feel like, it feels like you're going towards and making a good decision and at a good place. It doesn't feel like a normal doctor's office. It feels like it's actually integrated care, and I walk out feeling a lot better. Because we do, like you said, cover every base. So.
Well, excellent. Well, thank you everybody for joining us for the Right Time Tuesday. And we're really excited to be a part of this and bringing this service to the communities that we serve. Again, reach out. Phone numbers there. You can reach us at info@spectrumhealthcare.org. And we would be really honored and pleased to be able to provide service for you. Stay safe and be well. We'll see you next month. Thank you.
Bye. Nice to meet everyone.